Welcome back to the Traders Network. I'm Michael Yorba, your host. Thanks for joining us. We're also streaming to you live on yorbamedia.com. All right, I have, broadcasting to you from the Dallas KFXR 1190 AM Clear Channel Studios. All right, this segment, I've got Eric von Hofe, president of Antigen Express and Autoimmune Company, symbol GNBT, and this stock is definitely on the move. All right. Eric, welcome to the show. Thank you for showing up.
Thank you much. Pleasure to be on your show.
Oh, mine too. All right, please tell us a little bit about your company, and then we can get into some of the talking points.
Sure. So we're an emerging biotech company that's focused, as you indicated, on immunotherapy. So what we're trying to do is use some of the new information that we have on the immune system to be able to stimulate it, to identify targets that it can go after a little bit but not effectively, one of those being cancer. So that's the main focus of the company. It was spun out of the University of Massachusetts Medical Center about toward the end of the late 90s, and it was acquired by Generex Biotechnology about 10 years ago.
Okay.
So we now have a couple of clinical trials and are making good headway here.
So, well, let's start there. The clinical trials, walk me through some of those. What are you doing there?
So the clinical trials were initiated back in 2005. So this is some technology that was developed, as I mentioned, from the University of Massachusetts Medical Center. The main trial that we're focused on is on a compound we developed that stimulates the immune system to recognize cancer cells, specifically breast cancer cells. So in this trial, we have enrolled patients who have had the earliest stages of breast cancer. They've been treated with standard of care. And then they're giving a regimen of our therapeutic vaccine in the hopes of trying to reduce their chances of relapse. So that's the main focus currently.
Okay, all right. It's becoming a big topic here, autoimmune therapy, and walk us through the changes that are in the industry sector and how you fit in there with that.
Sure, yeah, no, it really is an exciting time, as you said. Science Magazine declared it Breakthrough of the Year, which is kind of interesting. I mean, science covers all areas of science from molecular biology to astrophysics. So they focused in on cancer immunotherapy. The field had had a difficult time up until probably about 3 or 4 years ago. There were lots of trials, not a lot of successes. So in the last couple of years, though, there have been successes, and that's shown people how better to use this type of immunotherapy. People have gotten, the big pharma's gotten interested in it. People realize that this is going to be a treatment modality that will constitute the backbone of cancer therapy, I think easily within the next 10 years.
The way I understand it, you're leading the charge on this one. Your company is.
Well, we're certainly out in front there. We went through the rough years, as I mentioned, up until 3 or 4 years. It was really tough going. So we were basically there in the trenches, doing what needed to be done, pushing this forward. So it's gratifying to see the field really starting to open up.
Open up the technology side of this to us. Bring that out.
Sure. What we do is we take a piece of a protein that's specific to cancer cells. In this case, it's called the HER2 protein. So we simply take a small fragment of that protein, modify it by our proprietary technology. It's important to point that we have a technology platform that we're using here at the company, applicable to lots of different targets. That fragment is modified in such a way that it's easier for the immune system to see it. So the immune system can more easily recognize that protein as something that's bad, that it needs to go after, and mounts a much more robust immune response, and also has immunological memory, which of course is the main thing. What that means is that at time periods long after treatment's ended, the immune cells are still out there, still looking for and killing cancer cells. So that's the main aspect of our technology that's different than what's currently out there.
All right. What about the fact that you're really nearing the end of the largest controlled randomized trial of breast cancer vaccine ever conducted? Well, that I want to hear about.
Right. So this is a study where we've got roughly 300 patients enrolled. We just completed enrollment. So, it's a very big study, randomized, controlled, very well-conducted study. Big database in terms of safety, the different types of patients that constitute breast cancer patients, And what we've seen so far is a good trend toward reduction of relapse in patients that have received our vaccine. So, we're very excited to move forward with that, to talk to partners, prospective partners, and update them on on the specifics of our results. The full gamut of all our results are going to be presented hopefully at the American Society of Clinical Oncology in June. We're planning to do that. And that's where we're going to really, update everyone in terms of where we are, where the results are, and, the best way forward.
What about prostate cancer?
Yeah, we had a phase 1 trial in prostate cancer. The issue there is that studies previously showed that this particular protein we're going after, the HER2 protein, it expressed between, in something like between 20 and 80% of prostate cancer. It was all over the place. It turns out that low to intermediate levels of this HER2 protein are in probably like 90% of prostate cancer. So that's an important point. I mean, there's this one drug out there, Herceptin, that goes after patients, particularly breast cancer patients, that have the highest levels of expression. That's about 25% of the breast cancer population. Because we're using immune-mediated mechanism, we can go after patients whose tumors express much lower levels of HER2. So that's actually twice the size of the population that's currently eligible for Herceptin. And if you look at other cancers like prostate, you can see that most patients express some level of this HER2 protein. So we really have a much bigger target population than is available to Herceptin.
As you get through the various stages of these clinical trials, do you see Antigen expanding their role in curing or working to cure cancer in other forms, whether it's colorectal or it's lung, things of that nature?
Yeah, absolutely. So our plan has always been to, we're a technology platform company, so our focus is on stimulating the immune system. So what we do is we'll set up a collaboration with experts in the field that are, say, experts in breast cancer, colon cancer, whatever, get a critical mass of people together in collaboration with pharma, and then move the next product forward. So we're very much looking forward to essentially the next compound. We've done clinical trials with targets other than the current breast and prostate cancer. We've got preclinical candidates for melanoma, for HPV, and this is in the immune therapeutic setting. So our business model really is to make use of the technology platform that we have to develop a variety of different types of these products.
Well, there must be something to this because your stock hit a low back there at the end of 2013. Throughout that year, it seems to have been building volume. There's been people looking to buy it, and then all of a sudden, at the beginning of this year, it took a very big move to the upside. And what was going on at the beginning of 2014 that caused so excitement with your company?
I think it's a combination of things. One, as we talked about, a lot of it is cancer immunotherapy is getting a lot of attention. I think 3 or 4 years ago, people were very, very pessimistic about it. But it's clear that certainly is, a very valid treatment modality. And, they took another look at us and said, gee, okay, these guys have been in there. They've got a very nicely run phase 2 trial, controlled randomized trial, the biggest one out there. Maybe there's something there. So I think that's really kind of what happened when people took notice of us, and also the fact that cancer immunotherapy now really is beginning to look like a valid treatment modality that, in fact, in a couple of years is, very likely going to dominate the field of cancer therapy.
Wow. All right. Forward-looking, without getting yourself in trouble, forward-looking things as we go into the rest of 2014, something for the investors that are listening in the audience, not just the patients.
Sure. So as I said, we're looking forward to releasing the full gamut of data from our recent analysis at the American Society of Clinical Oncology meeting. So we're in discussion with prospective partners, and I think as you indicated, things really have started in the beginning of this year. And where cancer immunotherapy is, I think there are a lot of people out there. In fact, I know they are that have not been in the field of cancer immunotherapy and are eager to find something. So we're very optimistic looking forward that we're very much in the right place at the right time.
It sounds like you definitely are, and your stock certainly says it. I mean, this is a very, very positive sign for me to see this pattern here. Contact information for you for any of our audience members that want to know more.
Sure. They can go to our website, which is antigenexpress.com. You can also email me at evonhofe@antigenexpress.com.
Great. All right, Eric, thank you so much for coming on to the show. Keep up the great work. I can tell somebody knows something in there and they're buying this thing. I appreciate you being here.
Thank you very much, Michael. I appreciate it.
My pleasure. Eric Van Hofe, President, Antigen Express, antigenexpress.com. All right, coming up next. Oh, and by the way, special thanks to Monk Media and 1-800 Public Relations for all their PR and media support. All right, Aftab Kashrif, CEO, Skill Gigs, coming up next. This is another breakthrough company for us today. We're having a bang-up day. We'll be right back.